DeSales University Virtual Scholar Series topic, Street Medicine, and why is it important? My name is Jackie Parker, and I'm the Director of Affinity and Campus Engagement here at DeSales University. We are here, live here on campus in the Outpatient Clinical Skills Lab in the Health Simulation Center, located in the Gambit Center for Business and Healthcare. We would like to welcome all of you, our alumni, our parents, our faculty, our staff, students, and our friends here at DeSales University to join us for this very special program. As the school year is just about to start here in a couple days, this room will be a home to our PA program who will invite 80 students in their cohort to be here on campus. They're going to be working here for our community. Among those physician assistants who have gone through the program, we are so glad to welcome back two very special alumni. Nani Cuadrado, who was just named PA of the Year by the American Academy of PAs, a former assistant professor at DeSales, and is now the program director and physician assistant for Valley Health Partners Street Medicine, is here with us tonight. And she is joined here by her colleague at Valley Health Partners, who was also working in street medicine, Seth Campbell. Before we get started, I would like to remind all of you at home to please, if you have questions, please use our chat box. I am joined here tonight virtually with my co-host, Dan Vellante, Director of Alumni, who will be looking at that chat box and feeding questions to our panelists. So we would like to start tonight's program by welcoming our moderator for tonight's panel. Dr. Wayne Stuart has been serving the DeSales community for over 15 years. During his time here, he has served as division head, program director, assistant professor, and is a board-certified orthopedic surgeon and medical director of DeSales Free Clinic. We welcome Dr. Stuart.
Thank you, Jackie. So welcome everyone, welcome to DeSales. I'm really happy tonight to have two absolutely distinguished alumni here with us to talk about street medicine. So Nani, Seth, what is street medicine and why is it important?
It's great that you should ask that, Wayne.
Funny, I should ask that.
It's funny you should ask that. We actually have a presentation that we want to share with everybody.
You? Please share.
So, hello everyone, welcome. If we go to the next slide, street medicine isn't just here in the Lehigh Valley. It's really an international movement, and there's an International Street Medicine Institute that is comprised of over 85 cities, over 15 countries around the world. So here in the Lehigh Valley, we are along the same mission and same lines as our brother and sister communities around the globe in treating folks wherever they feel comfortable. And I think if we go to the next slide. There's different programs around the world. Again, there's health network partnered or affiliated. There is nonprofit, nurse-run, volunteer, private, and federally funded. And Valley Health Partners is actually looking to get designation for a federally qualified health center lookalike. And it's comprised of 8 different departments in Allentown, from Valley Health Partners out of Lehigh Valley Health Network, and it's coming together to provide a welcoming environment for multidisciplinary care locally. And if we go to the next slide. So when did it all begin? I actually was able to talk with Brett Feldman before coming on tonight, and he reminded me actually that it really started when he was, after he graduated from Penn State, he was dating his now wife Corinne, who's also a physician assistant and awesome. And at the time she was in school in Chicago, and he shadowed her and participated in one of their student-run free clinics at a shelter. And he really noticed how students took to the folks there and how they were almost rejuvenated and reset because they might have become jaded out of their some of their rotations, and it just revitalized them and gave them an outlet to really come back to why they got into medicine. So then fast forward to when Brett was here at DeSales, he started up the DeSales Free Clinic at the Allentown Rescue Mission, and shout out to Dr. Stuart, when he was setting it up, he needed a medical director. And Dr. Stuart stepped up and has since been the medical director of the DeSales Free Clinic. So that has allowed students such as myself and Nani some hands-on experience with folks in Allentown and taking care of them at the Allentown Rescue Mission, which has been lovely. After Brett graduated, he started with Lehigh Valley Health Network as a hospitalist, and over multiple years, he was kind of known as the guy to go to for somebody that was hospitalized and homeless. And he noticed that the folks that they were discharging to the rescue mission or to the streets, there was a lack of follow-up. So he got together and was able to go out, and he was granted time 1 day a week to go out and perform street rounds to follow up with the folks that he was seeing in the hospital. And that was really the birthplace of street medicine here in the Valley.
So Brett and Corinne are now out in Los Angeles doing street medicine there.
Absolutely, same work and doing fantastic.
All right. Well, I want to share a little bit, somehow the arrows got funny, but I want to share a little bit about our journey, because it's actually super fun to share. And this is the first time Seth and I have actually talked about it. So out in Colorado, I was working in pre-hospital care. I was on the search and rescue team. I was really enjoying the life outside, working outside, and then found out from my father, who was a preceptor, that there was this small college called Allentown College that had a program for physician assistants. And so I had looked at going to nursing school. I actually had gotten in so that I could become a flight nurse, but my father had encouraged me to defer entrance into nursing school and apply for the PA program in Allentown College, plus a little bit of selfishness because I had his 2 grandkids out in Colorado. So I joined Allentown College in the graduate PA program because I had my undergraduate, so I came in 2000. And then once I graduated, I began working at Lehigh Valley Hospital in the emergency department for about 10 years, joined DeSales as an assistant professor, then began volunteering at the Free Clinic as a preceptor, and working with Brett, who said, hey, I'm moving to LA. What do you think about running the street medicine program? And so I got to become the program director and really join. But then at the same time, this is what was happening, which was so fun. So there was this high school student that was going to Parkland, and he joined the Emerging Health Professions program. And so it got him out into the community and seeing different avenues of medical programs to see what might be a fit. And Seth shared he was struggling with things, and I had this high school student from Parkland, and again, we were both from Parkland, so it was kind of a really cool, and he actually shadowed me while I was working in the emergency department. And he shares that he decided to become a physician assistant during that time, and later became part of the 5-year program through DeSales, which was also really fun because I ended up teaching him as an assistant professor in the program. He had the first elective with street medicine, and then Brett had hired him to be a per diem PA, and now we are colleagues and the 2 PAs that run the program at street medicine. So it's a really fun journey to kind of look through and kind of reflect on, but that's our journey. Next slide. Thank you. And so a lot of folks will ask, why do we work with homelessness? And really, there's a lot of reasons, but poor health and the life expectancy is really quite stark. So the average life expectancy is about 47 years for someone who's experiencing homelessness, but for you and I that are housed at 78 years. And so that's even just one tidbit of why this work is so important. All these pictures, by the way, are folks that have given our permission to actually share their pictures. So I think when we talk about homelessness, it's kind of nice to start wide and then focus in on our community. And so worldwide, these numbers reflect something called a point-in-time count. So point-in-time is really where they take 24 hours and they look at and count folks that are experiencing homelessness. There's some very strict criteria for that, from chronic homelessness, and that's really what they're focusing on. So right now, these numbers take into account that these numbers are very much underreported because we're only looking often at chronic homelessness. We're not necessarily counting folks that are sleeping on couches, that are living in hotels, that are living in situations that you and I might consider, well, that's housed, but truly not really what I would consider my own key and my own home. So the United States has over 500,000, according to this count. And I wanted to share two numbers because there's something that's really important to understand as we're looking at data, because data can be skewed many different ways. But in the Lehigh Valley, the chronic homelessness point-in-time count for 2019 shared that there was 2,032 folks that were experiencing homelessness in the Lehigh Valley. Back in 2015, when Brett Feldman was trying to show the need for the work here, he did a small study in the emergency department. He looked at Lehigh Valley Hospital in 3 different hospitals: Cedar Crest, Muhlenberg, and 17th Street, for those of you who are from the area. And he interviewed folks that came in to receive health care in the emergency department, and he and a team did that. And what they found was an average of 7% of persons that came to those 3 emergency departments were experiencing homelessness, according to their definition of homelessness. So that personal definition. And so that extrapolates to 9,300 persons, and that's back in 2015. So clearly there's a happy medium somewhere between the data that is counted in the point-in-time count, but also how people are experiencing homelessness now. And certainly with COVID, that is actually a huge concern, because right now, obviously, we have the eviction moratorium that's about to be lifted. So I really do expect that this number is going to become quite high. Next slide, please. Is this you or me?
Go ahead.
Okay.
You're doing great.
Okay, so I think you would expect this, but I think it's really helpful to kind of go through the barriers. And again, nothing crazy to think about, but transportation, of course. If you have no home, most people don't have transportation. They may have it if they're living in their car, but oftentimes it's not well run anyway. So transportation, lack of insurance is also key. If you don't have an address, therefore you lose your insurance, so therefore you don't have insurance to take care of yourself and your health. Obviously, if you don't have an address, you also eventually, when your identity and your license expires, you also don't have identification. So then you don't have identification. And then I think first and foremost we see is a lack of trust in the healthcare system. I think our folks have really struggled to find folks that actually hear their story and see them as human beings. And so this is a huge trust barrier, I think. This picture, before you move to the next slide, is one of my favorites. And so, if we could go back, if you don't mind. So that is Seth. And so thank goodness this patient actually reached out to a colleague of ours, Pastor Bob, who was also on the team, Bob Rapp, and said that he had fallen and tripped out of his tent and was having difficulty walking. And so Bob called Seth, and Seth said, sure, I'll be happy to go down there. So Seth took his team out, met with this patient, and found him to have a distal fibula fracture, for all of you who are medical folks out there. but the problem was he was very far into the woods, and he had come down a hill and was underneath a bridge. And so thank goodness this patient had Seth, because Seth threw him on his back and carried him up to the road and got an ambulance to take him to the emergency department. So I would have had to call the ambulance and get the search and rescue team, because that would not have been me. But anyway, I love this picture because our team is so amazing at doing, like Dr. Stuart said, whatever it takes. Next slide, please.
So, looking at street medicine, here in the Valley, we run clinics out of soup kitchens and shelters throughout Allentown, Bethlehem, and Easton. But the bedrock of street medicine is street rounds. So you can see Nani's backpack in the background there. Mine's here. We can go over what's in it later on maybe. But the tagline of the Street Medicine Institute is "Go to the people." And that breaks down the barrier of transportation. We carry medications to dispense on site, which again, not only takes down that barrier of getting to the pharmacy, but the barrier of cost. So we tend to bring quality clinic care out onto the streets. And again, that's the real true definition of street medicine, is providing care outside on the streets. And here in the Valley, it's more so under bridges, in, semi-permanent structures in the woods or tents. That's really what it looks like more here. But again, street rounds is the bedrock. We're out Monday, Tuesday, Thursday, Friday. If you see a couple folks walking with a backpack and finding their way down a bridge, that's probably us. And if you honk, we'll wave. But third prong of our approach is the street medicine consult service in the hospital system. So when our folks are sick and enter the hospital, we receive a consult just like somebody that might have had a heart attack gets a cardiology consult for a heart doctor to see them. Anybody that's identified as homeless gets a street medicine consult so that we can engage with them and really attempt to establish that trust with the patient, so that when they are eventually discharged, that we can follow up with them on the streets. We know their story and kind of get down to business and provide that primary care on site wherever they are. And sometimes it's just finding out where they'll be, so that we, because one of our duties and our missions is to go out and find folks that are out there and in need of this care, and the consult service allows us to kind of streamline that process when they're at their sickest point. Respite care has got to be one of the greatest things that's been started, not just here in the Valley. There's multiple systems throughout the country and nation, and world, that have respite care. So medical respite is for folks that need short-term recuperative care. You can imagine a homeless patient with a wound on their foot, on the bottom of their foot, and say they have diabetes, they're out walking the streets and it becomes infected because they don't have access to the proper wound care. They end up in the hospital, they get the proper care, antibiotics, wound care, but then they're back out on the streets. Walking the streets, because when you're homeless, you don't want to sit somewhere and look homeless. You want to look like you got someplace to be, and most of the time they do, and end up back in the hospital because they weren't able to access the wound care daily that they needed. Again and again, they eventually end up with amputation, millions of dollars later, lots of suffering, where the patient could have been given a hotel room, 3 meals a day, laundry service, weekly or bi-weekly visits from us. We can schedule home health because they have a room number and an address. And we can really work with them there so that something as simple as a wound on somebody's foot is healed up. We can control their sugars a little bit better while they're there, and kind of really more so establish care. So that's the idea of medical respite. But we've had patients with cancer, different surgeries, and just about burns, anything you can imagine that needed that short-term recuperative care in a clean environment. Over the past couple of years, it's been grant funded, and thank God for the grants that we've received to do so. And we're always seeking more because the need will only become more great. For telepsychiatry, that's the photo there, again through a grant through the Baker grant. We were able to bring out psychiatric services to folks in shelters, out in the woods, again bringing the care on site. And through that, not only provide direct therapeutic care through the iPad with a behavioral health specialist, but also connect them to an outpatient psychiatrist if they needed medications. I am going to make it through this list. So
It's all good.
the mail service, so I don't do a whole lot with it. It's really our support staff, and we have just a fantastic team. I wish they could all be here. They could all speak of this in lengths beyond me, but when you're homeless and you don't have an address, it's hard to get identification, insurance, benefits, apply for a job, get a phone. Without an address, you can't do a whole lot, so we provide an address to the hospital. That mail is couriered to us, and then we bring it out to the clinics and deliver it to our folks. It's really only for, job and government benefits, though. For care coordination, you can imagine the lack of transportation, so bus passes, taxi services, and scheduling that, connecting people to doctors. Two of our access coordinators have been super helpful in getting folks into appointments, whether that's with neurology, getting into the dentist, for optometrists for glasses. So the care coordination could, take 24/7. We could be doing care coordination, but that's a large piece of what we do. Survival support, we get donations of items, tents, tarps, sleeping bags, backpacks, water, socks, which really allows us to do the job that we do and kind of offer that, because sometimes it's when you come up on a patient that you've never met before and you ask them if they could use a bottle of water. It's non-threatening, or if they need a pair of socks, hey, could you use a pair of socks? It opens the door to a conversation and to kind of build that trust, and then we can maybe see if they want a blood pressure check and go from there. And then I'll probably leave the pet services up to Nani, because that's really her domain. But for little puppies and kitty cats out there, Nani really connects them to veterinarians when they need it. Next slide.
So, a lot of our folks have companion animals out in the woods or where they're sleeping, and they have a hard enough time taking care of themselves, but it's really important to be able to support their pets and their companions, and they certainly don't have the money to do that. So we have connections with the Lehigh County Humane Society that gives all the immunizations for free, neutering for free, acute care for free, and then we also have a no-nonsense neutering relationship where they get all neutered for free too. So that's been for those that have their pets, they very happy for that.
Absolutely. So I'm going to go over this slide, and then we got a little story going that Nani will take. But over the year, we have almost 1,700 visits, individual outpatient visits throughout, a calendar year. A little over 300 inpatient consults through the mail service, almost $230,000 in benefits, whether that's from the stimulus checks that came out, which was a lot of that, SSI, food stamps. So these are all things that have improved the quality of life of our folks that otherwise they wouldn't be able to access without the mail service. So, and then lastly, our readmission rate. For the house population, I believe the last time I checked it was roughly around 14%. So for some of the barriers to care in the outpatient that our folks face, discharge from the hospital does not happen very quickly. So through the consult service, we've been able to bring that down closer to the house population rate, which, it's not that anybody really wants to be in the hospital for longer than they need to. And the consult service allows us to make sure our folks don't have to stay in the hospital longer than they need.
Awesome. Next slide, please. Thanks. So I wanted to share just one story. There's many that will probably come with some of the photos, but this was a true story of multidisciplinary success and how working together within our organization and with community partners really can mean success. We met this patient while we were actually looking for somebody else. She was living out of her car with Pac-Man, her little companion animal. And so we established care with her. We connected her to some telepsychiatry services. She was really struggling with depression and PTSD, and our telepsychiatrist, our behavioral health specialist, worked with her, and not only worked with her to get her medication and get her connected to psych services, also certified Pac-Man to be her support animal, which was going to be helpful down the road when she needed to go to find a place. During the time that she was working with our behavioral health specialist, she shared that she had an addiction to some substance uses and that she was ready for treatment. Couple barriers were, one, that she was worried about Pac-Man and who was going to take care of Pac-Man while she was receiving treatment, and then because her car was her home, what was going to happen with her car while she was in treatment. So while she was ready for treatment, she was really worried about those two very big barriers. So we contacted a partner within the hospital, and she was able to find a bed for the inpatient work that needed to be done with our patient. And then we called our partner from No Nonsense Neutering. She had a friend that was willing to foster Pac-Man and had another organization called Caring Hearts. And they met, and our patient agreed that Pac-Man would be just fine under her care. And then we called security, who would love to tow a car that sits there for a month, and they agreed that while she was getting treatment, that they would be happy to let her stay, and they just told me where to park it, and she could leave it without worry of it being towed away. So it was really just a great story of success, and she came back. She went to a recovery home, doing really well. She's actually applying for jobs again, and so things have gone really well. And now that she has Pac-Man as a support animal, the tag is actually bigger than he is, and so but it's just a really lovely story of how everybody working together can really make quite a difference in someone's life. Next slide, please. And so I think we've been very blessed to be able to do this work, but there's always a need, and I do expect with COVID that we're going to see more need. And so I wanted to share 3 calls to action. And so one, if you are in this area, our team covers Lehigh and Northampton County. And so if you see someone that is in need that you would like us to care for or find out what they need, I've shared on this slide the number of our community health worker, Patrick Smith, and he is fantastic at identifying. He calls, he builds the relationship, finds out where they are, what we can help with, and so then he tells Seth and I what we need to do. So I've shared Patrick's number on there for you. In case there's a need for more and someone wants to donate survival items or make a monetary donation, our site director, Benny Eliason, I've shared her work number on there, and she can help to share the list of items that our patients need. She can share where donations can be sent to, and so I wanted to share that with you as well. And lastly, sometimes after presentations like this, folks say, hey, I live in the area, I'd love to volunteer, how do I do that? And so I've shared our HR manager, Ailey Lip. I've shared her email address so that you can tell her that you saw a presentation, you're in the area, and she can get you started with the paperwork to join us as a volunteer. And we have a lot of needs, so it doesn't just have to be medical. In fact, we have a lot of needs, that from marketing to organizing our donation closet to helping make phone calls on the behalf of the patient. And so there's a lot of need out there. And so please don't feel that if you want to volunteer and you're not medically inclined, that there is nothing for you to do, because as you may not know, we have a team of 11, but only 2 of us are providers. And so the rest of the team really holds us together. They just tell Seth and I where to go and what to do. So there's a lot of need, and there's a lot of work to be done still. So I wanted to share the call to action. And I think the next part is so one of the things I think that, as Seth shared, is really that the core of what we do is street rounds. And so I understand that there are roughly about 50 of you tuning in, but there may be more down the road. And so I think virtually, I'd love to take you on street rounds, and Seth will take you on rounds and just kind of share some of the photos of the work that we do and the various locations that we do it, so that you can be an armchair street round traveler with us. So this is a picture I took of Seth on the left hand side, caring for a patient just behind Central Catholic. And so that place is a little bit less busy now because of the construction going on, but this was someone that we took care of. On the right hand side is myself and one of our nurses to share how important the public libraries were in our patients' lives is really an understatement. And so once COVID happened, all the public libraries were closed, and this was really a haven for many of our patients. And so they went there to get warm, they went there to go to the bathroom, they went there to get on the computer, find jobs, read books and newspapers. And once COVID happened, all the libraries closed, and this was really a hardship for our patients. And so this is one of our patients on a day of about 0 degrees, and he went to the library to sit outside, hoping it would open, and it didn't. And so somebody had called and shared that looked like he was suffering, and he was cold and miserable and needed medication. And so we went to care for him there. But again, the library has been such a joy to have as a resource for our patients, and something that we didn't really think about till we didn't have it. So that's a picture of that. Next slide, please. We shared that we cover Allentown, Bethlehem, and Easton, so Lehigh and Northampton County. So the picture on the left-hand side is some of our team overlooking Easton, and the railroad tracks. There's some camps kind of tucked around the railroad tracks that are there, and it's just a lovely area. But lots of nooks and crannies where our folks have learned to survive in camp. So that's that left picture. On the right is actually heading up the railroad tracks of one of the encampments in Easton. And as you can see, it's raining in that one. So our team is really non-complaining, and they're just fantastic. And so we are blessed to be able to have a team that does not care whether it's raining, snowing, sleeting, because we've been allowed to go out during all of it. So we never stopped during COVID. We never stopped during snowstorms. And when all the other offices close, they give us permission to go out and shovel out our patients. You'll get to see some pictures of that. And so I think we feel really lucky that we can do the work no matter what the weather. Next slide, please. On the left-hand side, is a picture of another encampment in Allentown, and again, just really beautiful areas. Those are 2 access coordinators that have joined our team, and what they do is, I mean, it's hard enough as somebody that knows the medical system to understand how to get access, to get appointments. And we have these 2 ladies that come out. Not only do they help us, but they will direct schedule our patients. So, and that's for Lehigh Valley. And since we cover both Lehigh Valley and St. Luke's patients, if they have a patient of ours that goes to St. Luke's, they'll call St. Luke's, and they help get them into St. Luke's appointments. And so we've been very blessed to have them join our team and really provide just, I mean, we use them for ourselves. They're fantastic at getting appointments for us. So that's that picture on the left. On the right, we had a patient that had a leg abscess, and he did not want to go into the emergency department. He did not have good experiences there, so that's us draining an abscess in the street at Hamilton and Union, I think, around there. And so that was a lot of fun. And again, we carry all that in our backpack to be able to do that. So that's the picture on the right. And it was a cold day that day, so he was actually being very brave, exposing his leg. I think it was like in the 20s that day, so it was cold for him to be exposing his leg. But next slide, please. Go ahead, take it away.
And I do hope to do some questions. Love a good question and answer. So if you do have any questions, I guess we're writing them in the chat box. But as far as that goes, I look forward to that. But yeah, these are just some more photos of us going out in the snow. It's been really great working with the leadership at Valley Health Partners, allowing us to go out and do this, because when you show up on a day like this, your patients don't expect you. They would expect you to stay home. And it's just a part of building that relationship and reconciling the patient-provider relationship, that, bringing some hot coffee and a shovel and making sure we shovel off the tarp that's, the rope's gonna break and crash under their tent and it collapses, which happens. Kind of assisting on those days, and hand warmer goes a long way. So again, just a couple pictures of us going out in the snow. Highly recommend bibs. Just saying, if you get some
Yes.
Carhartt bibs, highly recommend them. But if you go to the next slide, please. And then again, some more snow photos. And on the heaviest days of snow, we go out. It's tough to ask for a blood pressure on those days, but in that regard, some of our folks are brave and will give us an arm to take a blood pressure, especially those that are committed to their health and making sure that their blood pressure is controlled. And you can imagine on that day, it's not like they're going to make it to the pharmacy for a medication refill. So having it in our backpacks, direct care on site, that that's acceptable to the patient. So,
We do have a question from Mark. He says, have you been able to deliver COVID-19 vaccines to the homeless patients?
Yes, we
Yep.
have. That was actually quite, it was mostly bureaucratic. That was just trying to figure out how do we get it to the folks that, and then what do we do once we use it. So absolutely, we have been able to do that. We had to think of clever ways also to transport it once it was open. So we had to keep checking temperatures and logging the temperatures, because we were carrying it in a cooler out into the encampment. So yeah, it was a really great experience. Our patients really appreciated not having to go in to get it done. So it was pretty successful.
this is a big trust thing too. It's not necessarily that even the access wasn't there, because our folks can sometimes make it into camp or make it into town, but some of them wouldn't receive it from anyone else than us, which is just a testament to the relationship and reputation that we've built from the begining.
Valley Health Partners has been very committed to getting our folks vaccinated, and so they've done everything they can to try to make it easy for us. If we have folks that need a second vaccine because they missed it, because they couldn't get to clinic, they'll give us a vaccine, even if it's not, if we have to, get a different brand name. So we've been very blessed to have that support.
We have Michael who says, great presentation. One question regarding one of the top barriers to care being distrust in the field. Do you feel this is due to the past bad experiences / judgmental providers, or more so worrying about the financial impact?
I mean, I can guess that. I can say that for us, it's really the bad experiences. And having worked in the ER for years, I've certainly seen it firsthand. And I think we just don't think of the story, what happened to get them to where they are, the trauma that had to happen to get them from holding a job, then losing that job, then losing their health insurance, and then losing their home, and then all the story that comes with it. And so I think in general, what we've heard, I think Seth and I have heard, have been just the experience of not being treated with dignity and respect. And I think that's really hard to hear that, because those are the institutes that we work with and our partners. But I think we've been lucky to rebuild that. And Seth can talk about the trust train, but I think
The trust train.
but they're riding the trust train now.
So the trust train, let's go over the trust train real quick. And thank you. Is it Michael?
Yes.
It was a great question, and please keep the questions coming. But that's basically when I was a student with Brett, and I came out on rounds with him, Brett would say, "This is Seth. He's okay. You know, he's all right," and they would welcome me into their home or their encampment, and by associating myself with him, I was given that trust almost automatically. So as far as as our team has grown, when we bring out a new colleague to camp, we introduce them, and since we have had that reputation from, you know, what was built at the beginning with Brett and really everybody, because there are so many people and names that I haven't, you know, stated that have allowed this to come to be, because it hasn't just been the folks, certainly hasn't been the folks just sitting here, there's so many more. But again, yeah, the trust train is just something like going off somebody else's coattails as you go along and building that relationship. But ultimately our folks have had, not everybody that's homeless, because I hate to generalize, but for those that do lack trust, they've had recurrent compounding negative interactions with mainstream medicine. And through that, a lot of what we do in street medicine is reconcile the patient-provider relationship. So there's simple miscommunications, whether that be at the hospital, whether that be in a clinic, at home with your significant other, family. Miscommunications can just blow up, and you're not even arguing the same thing or speaking the same language, even though, you know, it might still be English. And it really can deteriorate a relationship.
So can you please tell us about your bag? What's in it? What do you carry with you? And
Yep.
how much does it weigh?
We just weighed it today. It weighs 38 pounds. But we keep everything that we can to have a clinic. So I have some electronics. We have our computer, but I can show you. We have things to have procedures. So this was a backpack that was recommended, and my water, of course. But I can share. So this is, I don't know if you can see, I think, there we go. So this is our medications. And so analgesics, ENT, so ear, nose, and throat. We have hypertension. I've got airway, so respiratory meds, antibiotics, and stomach, GI, if we have heartburn, things like that. We have that. And then overdose, I have Narcan for that. We have a lot of wound care supply, and then smoking cessation, of course. I have that in here, some nicotine patches and some gum. So this is our wound care stuff. And then I have all of our vitals, things like that. So blood pressure, pulse ox. We have to make sure we have accurate pulse oximeter. We have our temperature, large and small cuffs. We even have, Seth found this one, and I really get excited about this one. We even have a little EKG. So it's just like a little 2-finger EKG that you run off an app on your phone. So I think that's kind of fun. So I got one too. I couldn't have Seth just have all the fun. And then I haven't pulled out my reflux hammer, to be honest with you, but I do have one.
Nice.
I think Dr. Stuart would be proud of me for that. I have stuff for ear irrigation. I have in here I still have my PA school otoscope in here.
Good.
I have This is for kind of short-term procedures that we, quick procedures. I have my surgical instruments and some things for draining abscesses and what have you. And then our computer and paperwork. So we have to establish care. We have to get people to sign paperwork like you would when you go to a doctor's office. And so I think we're pretty much the same. And then we draw blood. So this is, we can draw blood in the field. So I found these cool hard drive cases. So we have like a rainbow pack that we can draw blood, and then tourniquets and things like that to draw, and then the biohazard bag to carry it in. So that's what we have.
It's a whole clinic.
It's a whole clinic.
That's right.
It's amazing.
So, yeah, and then water to drink. And then this is like my PPE, so my like gloves and masks and things like that. And then I have electronic stuff here. So we have my cords, things like that, my Dremel tool for those nails, for those nails. And then we have a charger, so if I'm sitting in the camp and somebody's phone needs charging, it's a solar charger that I can plug someone's phone in if they need a charge, and while I'm doing the appointment, I can charge their phone. And so this is my electronics thing. I think that's
It's
it.
a nice OD green. Is it military?
It
or-
is.
Yeah.
It's a Blackhawk.
Yeah.
And so military Blackhawk. Actually, that was recommended to me because I didn't like having the big backpack that had all the one big pocket. So this had all the pockets that I liked, that I could keep things organized.
great.
So yeah, that's it.
So how long are you usually out when you go out on an excursion, going and visiting with the homeless?
It all depends, but again, we usually start a little before 8 a.m. You know, get our stuff together, get everything ready to go, because we like to start rounds just like any other office would start their or open their doors at 8 a.m. We like to say good morning, street medicine, in camp to announce ourselves around 8 a.m. From there, encampments vary in size, so you know there might be one person there might be two, there might be 20. Some of the folks might already be established with care, and it all depends on the acuity that day. If somebody needs EMS that day, it can turn into a search and rescue kind of thing. If they need a procedure done, to do that could take a little while longer. If it's a new patient, establishing trust can take actually listening to their story, which can take a few minutes. But it varies. Any encounter would vary. If it's on street rounds, just right on the sidewalk, from 15 minutes to 2 hours, just depending on the acuity.
Jade Rodigan asks, I think you know.
I think you know her.
I
Yes.
think we know her.
She asked a great question. She says, are there any ways you can recommend for passerby or those not directly involved in street medicine to make homeless individuals feel more comfortable or less isolated day to day? Also, I was wondering if Seth was single.
No, that's my fiance. Hello.
It's all in the family here. Right?
She couldn't help it, but I don't know, Don, if you want to take that one.
Sure. That's a great question, Jade. I think the single question actually is a great question. No, but the what do you do when you see someone? I think most of our folks feel unseen or unheard. So I think, looking at them, saying hello, looking, and not just looking over them, but looking at them, I think to me speaks volumes as a human being and being seen and heard. And I think that's what I would say. I think it's always some of the people that have volunteered with us now carry little goodie packs with water, some snacks. A lot of our folks are edentulous, or they don't have dentition, they don't have teeth, and so carrying things that are soft, like soft granola bars or soft snacks that people can enjoy. Sometimes I've been excited and I've brought out a crunchy granola bar and they're like, I don't have any teeth, sorry, that's not going to help. And so just if people really want to be impactful, certainly do that, but also share our phone number. if there's something that we can do to help support, we are happy to do that, so.
Absolutely. A simple hello can go a long way. And, you know, it's one of those things, if you don't even have anything to give, just looking at the person and saying good morning, you know, that can go a very, very long way, because it's tough, person after person after person, to not be looked at. And although they are there, and we all know that they're right there out of our car window or right next to us as we walk down the street, they can feel invisible. And that's something that, you know, treating loneliness in street medicine is something that we really try to do. And it's wild how loneliness can really take hold of somebody's life and just kind of wreck it. And especially day after day. So a simple hello goes a long way. You know, water's a great thing. If you tend to do more of a monetary thing, I'd recommend a gift card over cash. That's at least what I would do. But yeah, a simple hello, and thanks, Jade.
I just also want to comment too that I think while we have a backpack, and our stethoscope is really a tool of engagement, and I think looking at just building the relationship in a hello is really a tool. And so I think our team is more valued for the non-medical. Yes, that Seth and I feel pretty good about the medical care that we give, but truly the social service, the ear of listening, and the other survival items really go a long, long way. So I feel that everybody can do something depending on your sphere of influence. And so I want to encourage that, yes, while it's street medicine, there's a lot that can be done by just seeing someone and supporting them where they're at and meeting them on that journey.
You know, there's a real popular phrase now in medical circles, and I think that you really encompass it, and that's patient-centered care. All the hospitals are trying to do patient-centered care, and what does that mean? But you actually have the patient at the center of your care. You go out where they are and do that. It's just wonderful what you all do, I think.
Thank you. I think everything that we've ever done, all the services that we've offered, is because our patients have asked for it. And so we might have a different thing and plan in mind, but our patients say, this is what I need. And so I think we've been pretty good at pivoting to try to meet that need.
Yeah.
Fantastic. As both alums of here at DeSales, especially with the PA program, what do you think is the one thing you both took away from the PA program that you've been able to apply?
It's one.
Or gives you to feel inspired?
Oh my, I'm gonna take a minute to think about this.
I'm going to always go for the be who you are and be that well. I mean, I still think about that because I think it really doesn't matter, like, what you do, but that you do it well. And so I think for me, it sounds really simple, but I still, that quote still resonates with me, that St. Francis quote, and I think that to me is street medicine lives that, I think, but I think that's what I took away, that no matter where you go in your life, from your DeSales humanistic, traditions of learning, I think everybody can impact the world in their sphere of influence, and do that well. So that's what I took away.
So many stories, but as I guess in a level of, as I was maturing through undergraduate, Brett has stories of me walking into class in various ways when I was a junior, I believe, and then his wife was my advisor when I was here. But really, the focus on vulnerable populations has kind of given my life direction. So really focusing on allowing the patient to define the futility of care, because in medicine we're kind of hyper-focused on making sure everything's perfect in their health and they have the right medicine, and we save them. But really, asking the patient what they need, what's their priority, that's what we should really be focusing on, even to the point of doing an advanced directive. So this idea of kind of medicine in vulnerable populations and then allowing the patient to have final say and leaving your ego out of it is definitely something that I've taken from DeSales.
Now, with our audience watching tonight, we may have some future PAs out there that are interested in being in street medicine. What advice would you give to them?
Wow.
I mean,
Yeah, I was going to say, it's actually two good perspectives, because
Sure.
from high school, and then this is like a second, third, fourth career for me.
So, yeah, I mean, for physician assistants going into street medicine, I would say, once you graduate, get your feet wet in some capacity, whether it's in the hospital or outpatient setting in a general practice, rather than subspecializing when you get out, just so that you have an idea of what medicine looks like outside of school in your rotations, because it might be a little different. So jumping into a career in more of a hospitalist versus primary care setting, FQHC, Federally Qualified Health Center, look-alike, that's what I'd recommend for young or new physicians coming into the profession.
I think as an older student joining the program, it was the hardest thing I ever did, but it was so worth it. And I think I couldn't have done it without my classmates. And so I think about having tenacity, that no matter what field you go into, really those small, I'm not very good at individual study. I really needed my classmates to push me along, and so they did. And so I couldn't have made it without them. And I think about the idea of community, and I think of that in medicine, but I also think of that as surviving PA school. So I think about that, and when I taught here, I recommended that too. Find a group that's going to love you, support you, help you through this, because we could all do. I mean, Seth, you were the test question writer. I remember you would make questions and and try to help everybody, study well. And so I think it really takes a team, not just through healthcare to succeed, but through PA school. So I say grab onto your classmates and do what you can to get through school that way.
And if you want to talk about getting into school, or what can you do to become a PA or to go into medicine, regardless of what you go into, I think it's a matter of meeting people and getting experiences. Get out there and see for yourself what people do, and shadow a doctor, shadow a nurse, shadow a PA, go on street rounds, find somebody in your community who does that, and see what they actually do in real life, because you're going to be doing that somewhere down the road. So you want to really know what they're doing, not just what a book says or what the what you read on a website. Go out there and get that experience, and then you'll have a story when you apply to school. You have a story as to why you want to be in that school, and that's something that we're always looking for.
Yeah. I think it was wise to require 500 hours ahead of time, because I think that really then paints a clearer picture. I mean, this is the hardest thing you'll ever do, I think, and so you better know what you're getting into.
Yep.
So I think that was wise of the DeSales program to require that, because that's higher than some of the programs out there. So
It is,
but
indeed.
I think it's worth it.
Fantastic. Don, do you have any final thoughts that you'd like to share with our viewers at home?
We have a really great community, and it really started here. So thank you, Dr. Stuart, for continuing this on, and really this program. I'm excited that folks get to hear about street medicine.
Yeah, I think it's great. From my perspective, I'm a veteran, and so I hear all the time people say, "Oh, you're a veteran. Thank you for your service," and that sort of rolls off their tongue, and I'm not sure how meaningful it really is. But I say this to you now: thank you for your service.
Thank you. What a pleasure to get paid to do it.
Yeah, it's really made my life very simple, this work, and I wouldn't have it any other way.
It's great.
Agreed. Thank you.
Thank you all.
Yes, well, we want to thank you guys all tonight. Nani, Seth for coming back here to DeSales, Dr. Stuart for having this fantastic panel tonight to share with our audience, our viewers out there, more about street medicine and what they can do. Again, we will have more information after this episode of how you can get involved, and it's because of the support of viewers like you at home that really help these programs and our PA programs to be successful. And we thank you again. And if you missed tonight's episode, don't worry, we will have it on our YouTube channel and you'll be able to watch it back. But thank you, and we hope you have a great night.